Health. And he's going to share with you and talk to you about some of the initiatives that Health have been doing. Do you want to stand down here? And...
Oh, thank you. Okay, I have a...
Oh, okay, you have a... I didn't know that.
So my name's Paul Clariner, Director of Health Promotion for Northern Sydney Local Health District. And just very quickly, just to go through some examples of some of the stuff we're doing in preventing harm related to alcohol. And I suppose the bottom line is this, that alcohol, we know it causes a lot of harm in our society, especially within our health services, a lot of cost. And I guess in health promotion, we view this event, for example, as a health promotion event. And health promotion at a population health level is no doubt the most cost-effective way to reduce alcohol-related harm and the other big health issues. And by health promotion at a population level, I'm talking about all the things that have been mentioned today, the liquor accords, local government action, regulation, all of that kind of stuff. So just a really quick background on where we are. This is the health system as most people know it, the hospitals and the community health care services. And then there's at the population level where we work with local government, schools, state government departments and the rest of it. We have a strategic plan, and within that strategic plan, alcohol harm prevention is one of our major priorities. And like I've just said, the basic reason is because it's the third biggest contributor to our total disease burden, and that's a good enough reason in itself to focus on this as a way to reduce harm and improve population health in total. So within our strategic plan we have targets. Our alcohol-related target is that, to reduce the sort of the population level amount of alcohol misuse. Northern Sydney is already a little bit below the state average, but obviously there's a long way to go in all respects. So in terms of deciding what to do, I'll just quickly go through that. We're interested in as much reach as possible, as many people with our interventions, and then the most effect per person. And when you lay cost over the top of that, we come up with our cost effectiveness, and so that's where health promotion at a population level really comes into its own. In the real world, of course, we have lots of other influences, pragmatic things like the opportunity to build partnerships. One very major thing with alcohol is local issues. So we know on the Northern Beaches there's a youth underage drinking problem, and so we do stuff specifically around that, and so on. In terms of what works, what is the most cost-effective at that population level? It's the broad brush behaviour change levers like legislation and taxation, which are very reliable in producing behaviour change. Then we go down to things like physical environment, which is... so in terms of legislation, I mean, that's straightforward things like RBT and underage drinking rules and the rest of it. And then you've got taxation, alcohol tax, alco-pop tax, that kind of stuff. The physical environment can be, like I mentioned just before, about density of outlets and things like that. And then we get through to education and policy. And just to go back to that, I suppose treatment and early intervention is obviously very effective for those that receive it, but it is very expensive per person and it doesn't have a huge reach. So from at a population level, it's not an effective, cost-effective population level way to approach this stuff. And likewise, education and information, it's good to support the legislation and the taxation and the built environment stuff, but on its own, education and publicity, commercials, Drinkwise, that kind of stuff, it's not effective. So what do? We have a project actions document that you can find on our NS Health Promotion website, but effectively what we do mostly is work on underage supply. We've got the law on our side, which makes it very likely that what we're going to do is going to be effective. And one of our flagship campaigns is the Stop the Supply campaign. You might have seen this on bus backs and those sort of stuff, things, and also with different slogans. And the idea is to draw attention to the legislation, the underage secondary supply legislation around alcohol, and then promote and publicise when there are prosecutions to confirm that perception that the legislation is real and there's real consequences. And that's recently spread to different parts of Northern Sydney and the rest of Sydney on trains and the like. Responsible service of alcohol programs are an example of partnership programs that we do with the Liquor Accords and the police and the CDATs. And this is an example of all those stakeholders coming together in the Hornsby-Ku-ring-gai area, also in Ryde and in different parts of Sydney that happens as well. One of our bread and butter things is submitting when we do object to liquor licence applications. We get involved in the community impact statement process and provide the evidence around that. Like I said, we have our challenges with that. Sometimes we have success when we have a strong case. Other times it's a challenging process that I think there's improvement to be had there. And then finally, Embrace the Walk of Shame, which you'll see a video about. It's another campaign which is again a response to local issues on the northern beaches where there's an above average amount of people over the limit on the morning after. And you'll see that in a second. So in summary, this sort of stuff, it's the best bang for your buck in terms of preventing alcohol-related harm, and it really doesn't cost that much to do. And that's about it. Thank you.